Doctor on Call, we believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At DoctorOnCall, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online. So the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via DoctorOnCall platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.
And we are live. Hi, good afternoon, everyone. Thank you for joining the show. In advance, a very happy Chinese New Year. Selamat petang semua penonton sekalian. And gosh, my Mandarin cannot pakai, but 新年快乐. right? So my name is Dr. Jin Ng. I'm your host for today. And yep, for those who are not acquainted with DoctorOnCall, we are a technology platform that essentially serves to connect everyone, connect you, your family, to all your healthcare needs at the fastest, most efficient, and hopefully the most cost-efficient way as well. So whether you need a COVID test or you need to consult a specialist or a doctor, do drop us a line on our platform, and our care consultants will guide you through it. Right. So today we have with us a very special guest. It is with great honor that I introduce Dr. Ng Min Yeong, our consultant cardiologist, interventional cardiologist from Columbia, Asia, Setapak. Now, Dr. Ng, have you had your lunch?
Probably later.
Probably later. But later you have a procedure coming.
Yeah, that's a cardiologist life.
Yeah, that's the life of a cardiologist. So, before we just get right in, we can have some time, to let all our guests come in first. I see Noor Helias, Haziq, thank you for dropping in. Atika, nice to have you with us. Do remember to like and share this session. Get all your friends in, because today we're going to be talking about a very interesting topic with Dr. Ng, right? So, Dr. Ng, how is Chinese New Year going to be for you this year?
Definitely a different experience. I'm sure everyone also having the same feeling. No longer balik kampung and all this.
Yes,
yeah, I think CNY stand for new meaning now. Is celebrate next year.
Celebrate next year, or celebrate on Zoom, right? So you either cook, or you grab, or you tapao. There's just this.
Yeah, we do that. Like it's a new norm, I think.
Yeah, and so reunion dinner tonight or tomorrow.
Going to do some small one, not so grand. Try to comply with the SOP.
That's the politically correct answer, right, Doctor?
Yeah. the SOP.
Yeah, the SOP, right? Yeah. Hi everyone. Hi Jana. Right. So, Dr. Ng, you are a cardiologist, right? And I think the cardiologist is really one of the coolest profession. So always imagine, let's say you go to a wedding, or you go to a banquet, right? And then people come and ask you, oh, hi, Mr. Ng. So what industry are you in? And then you tell them, I'm in plumbing. I unclog people's heart. Say. But yeah, jokes aside, Doctor, why don't you educate our guests a little bit? Some of them might think a cardiologist are people like who cut open someone's heart, but obviously that's not the case. Maybe you mind spending some time telling them about what do you do on your day-to-day? I'm sure many are curious to know.
Yeah, I'm surprised that you know the joke of cardiologist. Yeah, cardiologist basically mainly like a plumber. I think we are sharing the same expertise to unclog some tubing. Okay, so and of course nowadays cardiologists also split into another field, another group of cardiologists called electrophysiologists. They are the electrician. So yeah, basically just we're handling the not only the heart, anything together with the blood vessel. We also deal with it, and we are not the surgeon, so I can't open the heart. We do everything minor trauma, so everything percutaneous. So it's no longer that scary. We come with big scar for most of the case, and we also emphasize a lot on prevention, a lot on disease prevention and retardation. So this actually will help. So I hope the public won't run away once they know I'm a cardiologist. I'm not going to cut open their chest and do that.
Yeah, and it is very important because the number of cardiovascular diseases are going up. So dear friends who are joining the show, please like and share. Oh, happy Valentine's Day. It is coming up, right? Yeah, I think my wife will be reminding me about this soon. Yeah. So since it's lunchtime, I think my moderators can be a bit generous, lah, right? So for those who are tuning in, I tell you what, like the show, share the show, and tag 4 friends. And I think my moderators will send you a little something for lunch. If tak sempat, then maybe tea time. Can or not, everyone? Huh? So like, share, tag 4 friends, and then I think my moderator, who's going to kill me after this, will arrange a Grab delivery for you. Because this is the first
It's
time
on
we're
you.
doing a lunchtime show. Huh? Yeah, then they're going
The
to
lunch is on you.
you.
Yeah.
Yeah. Yeah, so the lunch is on me, but then later the patient will go to you, Dr. Ng. All right.
Come.
So without further ado, let's get into the topic at hand. Now, today we are talking about cigarettes and smoking. Would you kindly share your slides, Dr. Ng?
Sure. All right.
Now, before, maybe you can put it on presentation. No, not presentation mode, but zoom in a little bit. Maybe you can get your team there to help you zoom in a little bit. So while they are working at it to make the slides a bit better, Dr. Ng, so I have a question to ask, right? So we'll be talking about cigarette smoking today. So when you were young, you look like the kind of a guy who has quite an interesting life. Have you tried, going with a puff before? Confession time now.
Okay. So, no, I can share with you. When I was, when young, definitely, I think those days, smokers can smoke anywhere. So the condition, the environment are like that. So you will expose to a smoker more often than nowadays, I think, because there's no rule restriction and different kind of smoke. So I always wonder why people are so addicted to this small burning stick. It's like, but the smell is just so pungent that I never like it. So I choose not to. And of course, my family, my parents strongly discourage us to do it. So at the end of the day, I can bet with you, I never taste even a single cigarette.
Wow, well done, Dr. Ng. As for me, I think when I was young, I hope my mom's not watching the show, but someone offered me, it's not a typical Benson and Hedges cigarette or something like that. No. It is a cinnamon vanilla cigar. Okay, so that's just a taste of it, but no more. So I'm not a smoker. So, okay, let's just engage the crowd a little bit. I think you have your friend here, Joanne here, reaching out, saying hi to you, Dr. Ng, and says that you are very good at jokes. Right? So, on, Dr. Ng will tell us something funny later from some of the experience with life. So, okay, ladies and gentlemen, we're going to jump right into the topic. Do get your friends to share. Like I mentioned earlier, like this, share, tag on 4 friends, and I think probably someone will send you something for tea time during Grab, right? And do feel free to ask your questions here. Although the topic is related to smoking, which is closely related to cardiovascular disease, feel free to ask any questions and we will try to address them one by one. So over to you, Dr. Ng. You can start.
All right. So how's the slide?
I think what you can do is, let me see. I think it's all right. Yeah.
Okay.
Yeah, I think, okay, now that you zoom in, I think it's a bit better, but some areas will be a bit small. What if you try clicking presentation mode, like full screen or something like that?
Now I'm in presentation mode.
Oh, you're already in presentation mode. Then I believe everyone else should be able to see. Yeah. So okay, go ahead.
All right. For the newcomer, good afternoon again. My name is Dr. Ng Min Yeong. I'm a consultant cardiologist from Columbia Asia Hospital Startup. I would like to take this opportunity to wish everyone Happy Chinese New Year again. Gong Xi Fa Cai for everyone. Hope this is a different but more happy New Year this time. Okay, today I'm going to share with you a topic related to smoking. First of all, my apology for the title. I understand that this doesn't sound nice for Chinese New Year Eve, but I hope this can create awareness for everyone to look into this matter seriously.
Yeah.
Okay.
And well, yeah, good. Not only does it kill you slowly, it makes you broke slowly as well.
Either way. All right. Okay. Tobacco smoking, a small stick of cigarette, introduce not only nicotine but also more than 5,000 chemicals, including numerous carcinogens. Carcinogen means that cancer-causing chemical into our body. So how much damage it causes to our body? It basically can damage to all part of our body, including heart, lungs, brain, even to the skin. So to the heart, it can increase.
You need to move your slides, Dr. Ng. I think it's not showing yet. The next slide.
Oh, I think.
Yeah.
Let me have some technical problem right here.
Yeah, no worry.
Slide.
Okay, I can see the next slide now. Yep, fantastic.
So. All right, let's try it again.
Yep. No worries. While they are setting up the technicals, we have quite a lot of people asking very interesting questions. You know, like Achik asking apa beza rokok dan vape. Wait for it. We will be coming to that. There are also people who ask about nano stick and how is that different. We will be addressing that later. So stay tuned. Hi, Joel. Juan has been actually asking a very interesting question. Everybody knows smoking is related to the lung, but how is it related to the heart? Now, this is very interesting. All right, back to you, Dr. Ng. We can't really hear you, Dr. Ng.
Hello, yeah.
Wow.
All right. Try to solve the. It is presentation mode in my computer, but I think the Facebook is slightly lagging behind.
I see. It's okay because it's the MCO, so everyone needs to use the internet. So now they are taking their break from Netflix and learning something about smoking. So it's okay that occasionally, you know, some of the issues are coming up. So while they're addressing the technical issue, no worries. We just want to say hi to the rest of our audience. For example, Taufik, who's asking, you know, is it dangerous for baby? Adakah bahaya bagi baby yang hidup asap rokok? Yes, we will address this question later. But I think most of us here would probably guess that it is very dangerous actually.
Okay, how about now?
Sorry, we are back on. Yep. Okay, go ahead, Doctor.
Okay, let's try whether we move on to the next slide. Are we seeing the next slide?
Yep. Go ahead.
So so that is how the smoking, how dangerous the smoking, the chemical can increase more heart cardiovascular disease to the heart and also increase the risk of stroke more than 50%. And yes, some of the audience are asking whether what maybe affected the lung. Actually, not entirely true. So the chemical actually travel around our body. It will damage our lung system as well as causing circulation problem to our blood vessel, blood pressure, and heart rate. It also causes numerous cancer to our mouth, throat, and even stomach and pancreas. And it will cause infertility to men and women as well. Most importantly, smoking, the chemical will prematurely age our skin by 10 to 20 years. This is particularly important to all the people that keep their skin young. And you also will cause our bone to become brittle and ended up with osteoporosis later. Jim, can we see the next slide again?
Yes, fantastic. It's working well now. Go ahead.
All right. So, do you know that approximately 1 out of 2 Malaysian men smoke, and more than 37,000 people in Malaysia are killed by tobacco-caused disease every year?
Wow.
Okay, why are we talking smoking right now? And we have high cholesterol, high blood pressure, or diabetes to worry about. Actually, I'm a cardiologist, so I am very concerned about cardiovascular disease. So among all the risk factors, including smoking, high cholesterol, high blood pressure, physical inactivity, obesity, and diabetes, all these are primary risk factors for cardiovascular disease. But smoking is the single most preventable cause of early death. Means that you might get other disease, but there's one thing that you will not, you will have your option to choose not to get it, is smoking. So what happens when you smoke? Normally when we breathe in air, the lungs will take up the oxygen and deliver to the heart. Heart is a pumping organ, so you have to pump the oxygen-rich blood to the rest of our body. But when you breathe in a cigarette smoke, the blood that distributes to the rest of the body are no longer a pure, clean, oxygen-rich. They are contaminated by smoke's chemical. And this chemical can damage our heart and blood vessel permanently. Okay. Wow. Cigarette smoke can also changing our blood chemistry and causing arteriosclerosis. So arteriosclerosis is a condition whereby the plaque is building up in the artery. So what is plaque? A plaque is a waxy substance comprised of cholesterol, scar tissue, calcium, fat, and other material. When the arteriosclerosis occurs, the blood vessel get narrow and blocked. So let me show you how the plaque form looks like.
Wow. So Dr. Ng, I want to ask, just sorry to interrupt you but by the way, we have quite a few people who have tuned in. Rachel, who have asked what's the best way to find out if your heart is healthy. We will address that later, but the best way is to go and see Dr. Ng Min Yeong. And then, hello, Stila, One asked, Doctor, adakah asap rokok yang melekat pada pakaian? I think she's referring to second-hand smoke, but when the scent is on a surface. This is very interesting. We'll address that later. Someone by name of Katie Tan also asked about second-hand smoke. And okay, so we will address that later. But since you're on the topic of atherosclerosis, and just now we make a joke about plumbing, so I believe this is where, the layman term people say it's clogged up, right? Where the vessels of the heart is clogged up. Now, in the past, we used to think if you eat certain food like bak kut teh or your nasi lemak or even your mutton curry, those are the things that cause it to clog up. But now, you're telling us that smoking causes the same effect as well. So, how true is that? And in fact, the food that we eat really causes it to clog up as well.
Yeah, all these habits and behavior actually correlated to each other. So when we have unhealthy diet, we provide all the substance like overload of cholesterol, overload of triglyceride. We actually provide a material for a blood vessel to form arteriosclerosis, to form the blood. And the smoking the chemical from the smoke will further facilitate this process to occur by damaging the structure of the blood vessel, and as well as make the blood become more sticky. And when the blood vessel getting narrow by the arteriosclerosis, the blood becomes sticky. It all will contribute to the disaster and end up to clog up the blood vessel. So it is one link to another one. So we always emphasize people to say that you cannot just tackle one problem to prevent ultimate cardiovascular disease. You have to bring down all your risk factors. You have to take care of your diet. You have to stop smoking and continue exercise. All these work together. So you can't tackle one problem to solve.
So, Dr. Ng, I think Shakir brought up an interesting question. Bahaya ke tak kalau berhenti merokok secara mengejut? So, I believe what he's asking is, if after hearing what you say today, someone else decides to just stop smoking today, is that dangerous or is that all the more better?
Over years of practice, I'm surprised that actually this myth is present among the folks, because people are thinking I shouldn't stop my smoking immediately or abruptly. So because this cause more dangers to our health other than continue smoking. So I promise you we will come to this topic later. We'll address about it.
All right.
So this is a blood vessel. Okay, as you can see, it is round and healthy. So this is yellowish color represent the arteriosclerosis, and as you can see, there's a damages over the lining. As years goes by, this yellow color will become bigger and bigger, and eventually obscure the whole blood vessel, and this will cause interruption to the blood supply to the distal part, and eventually cause ischemia, which whereby the heart attack occurred. All right. So immediately you smoke a chemical of a cigarette, it can cause instant and long-term rise in the blood pressure, and you also can cause instantly and long-term increase your heart rate. It reduces the blood flow from the heart by narrowing the blood vessel over our body, and it also reduces the amount of oxygen that reaches our body tissue. Smoking also increase our carbon monoxide level in our body. This carbon monoxide actually binds to our red blood cell more powerful than oxygen. So once all the red blood cells are occupied by carbon monoxide, there's no place for oxygen to carry in the red blood cell anymore. That's why a chronic smoker will constantly lack of oxygen.
And is that also why they sometimes feel tired very often because of the
Yes. For long term, when our heart system and the lung system functions are jeopardized, plus the amount of oxygen in the red blood cell also jeopardized, the whole body actually in a constant state of lacking of oxygen. This actually make the whole body function inappropriate.
Wow. So since you are talking about the effects of smoking, very quickly someone just asked, will taking Kila asked, will taking cod liver oil, because a lot of people say cod liver oil is good for the heart, really help to reduce the adverse effects of smoking? It's an interesting question.
Cod liver oil doesn't really will clear the clot in our blood vessel. Main thing, we have to go back to the source. So you have to cut down the source, then only you start the treatment. Probably will be effective.
Yeah, maybe we can talk about clots more a little later, because there's someone by name of Yap also asking, does traditional Chinese medication, help with the clots and things like that? Maybe we can address all about resolving clots a little later. Yeah.
Sure.
Great.
Yeah, sure. So again, the chemical of the smoke will damage our blood vessel structure, and it will form. It can cause abnormal dilatation, or even on the other hand, will narrow the blood vessel as well. So very importantly, the chemical of smoke, it decreases the good cholesterol and increase the bad cholesterol. Again, this will further increase the risk of cardiovascular disease. So as I mentioned just now, to the brain, chemical of the smoke, it actually increase the risk of stroke 2 times than those who are not smoking at all. And smoking actually has a link to depression and stress. So I have mentioned cardiovascular disease multiple times just now. Cardiovascular disease is an umbrella term for multiple conditions that affecting the heart and blood vessel. So these conditions include coronary artery disease, high blood pressure, heart attack, stroke, aneurysm, which means abnormal dilatation of a blood vessel, and also peripheral artery disease, meaning the blood vessel disease involve our limbs. So that, and all these conditions, one of the main culprit are smoking. Okay, so this is summarized of cause of statistic on cause of death in Malaysia in 2018. So there are 5 principal cause of death in 2018. So these 5 principal cause of death, including ischemic heart disease, number 1, the number 1 killer. Number 2, pneumonia. Number 3, cerebral vascular disease, means stroke. Number 4, only accident. Number 5 is chronic lower respiratory disease. So these 5 factors, number 1, number 3, and number 5 are related to smoking habit. And can you imagine that?
So many.
Yes. And can you imagine that there's average 50% death per day due to heart attack? That makes heart attack the number 1 killer. And the main culprit of causing heart disease, one of the main culprits are smoking. Those people who die because of heart attack, they are aged 41 and above. So who are they? Those people are the breadwinner of the family. Those people are the management, or even the boss of a company and leader of our country. So that's how a cardiovascular disease jeopardizes our social economy. And again, the culprit of cardiovascular disease is smoking. So do you know that 1 out of every 5 smoking-related death is caused by heart disease? Women older than 35 years old who are smoking and take birth control pill together are at much greater risk for getting a heart disease or a stroke. Cigarette smokers are 2 to 4 times more likely to get heart disease than a non-smoker. Cigarette smoking doubles a person's risk of stroke.
Dr. Ng, interesting when you brought up this statistic, when you mentioned women, above the age of 35 and taking birth control. That to some extent represents our city professional women, some of them who are on birth control and, are chasing after their career, and, and sometimes due to stress, they end up smoking. But, all of these things become a strong deterrent to their health in the future. And that is a real waste, correct?
Exactly. So the environment has changed. The norm has changed. I mean, those days when we talk about young ladies who is still in reproductive stage, 35 years old, probably there are lower risk of getting heart disease. But with the increased usage of smoking, tobacco smoking, plus usage of contraceptive pill, these actually give rise of higher risk of getting heart attack or stroke than normal people.
Wow.
So, okay. So we have come to another point of smoking. So just now there's a lot of audience asking about how about second-hand smoking, also passive smoking. Okay. So second-hand smoking is a smoke exhaled from a smoker, but it also includes smoke from burning end of a lit cigarette, cigar or pipe, and not just the air, the smoke that's floating around the air, but the smoke that already adhere to our clothing, our furniture, our environment, also the effect of side effect of chemical as well. So this answers one of the questions just now. So it's equally dangerous. Okay, so I'm not smoking, I'm just lighting it up and just put it there. No, it will still continue harm our health. So it only takes as little as 5 minutes of exposure will bring up the risk factor of getting a cardiovascular disease or even cancer. So for secondhand smoker, it increases the risk of lung cancer and many types of cancer by 30%, and it will continuously increase the risk of cardiovascular disease, just like a smoker itself. Children are particularly at risk because their body are still growing and they breathe faster rate than an adult. So this condition is linked to a secondhand smoke exposure in children, sudden infant death syndrome. It means that the baby will pass away without known cause suddenly, and it will increase the risk of respiratory infection such as bronchitis and pneumonia, and it will lead to more severe or frequent asthma attack. And ear infection is common, chronic cough is common in the family with
So, Dr. Ng, since you're talking about children, experience that I have last time when I was practicing in the emergency department, occasionally at night, I see parents will bring their kids come, with all sorts of respiratory problem, and normally the first question I ask them is, does anyone in the house smokes? And then, they will say, yeah, the uncle or sometimes the father, but they said they always smoke outside. And then now, now we understand that even if you smoke outside, the smell and the clothes and so is still affecting your kids, correct?
Exactly.
Yep.
So how about women? How about pregnant lady? So smoking or secondhand smoking are as dangerous to a developing baby for a pregnant lady. So chemical in the smoke can lead to premature delivery, low birth weight, again, sudden infant death syndrome. And later on, the baby might have challenging in their mental development, and they will have trouble in learning. Some of this condition also associated with the attention deficit hyperactive disorder as well. So, for people who are smoker in the family, you probably might think twice, and you should protect your family by quitting smoke. 3 out of 10 adolescents means age 12 to 18, smoke in Malaysia, and nearly 1 in 5 teenagers smoke. And this condition is only worsening by introducing vaping to this country. And nowadays, the design of a vaping machine, gadget, it's getting smaller and smaller. Some even mimic to a pen. So this makes the adult, the parents are more difficult to control their children to start vaping in the early age.
Yeah.
So, yeah,
Since you're on this topic, vaping, Dr. Ng, I think a lot of people are very interested now. So, kepada semua penonton, if you are interested to know or you have friends who's always curious about vaping, this is your time. Do tag them and make sure they come and attend this or watch the replay later, because I think this is very, very important. And a lot of people have a lot of misconceptions, thinking that vaping is a good replacement to smoking. Right. So Dr. Ng here is going to clear all the myth and give us a perfect understanding. Yeah, go ahead, Dr. Ng.
Yeah. So I think the initial vaping, the idea is they are trying to replace smoking with other thing, but eventually I think human nature will misuse all the good intentions and end up with even worse monster. So I will use monster because there is a lot of side effect getting more obvious, and the research, the trials are still ongoing to examine how dangerous is vaping, the myths, and how the mechanism will damage our health. Well, 10 years down the road, we probably will see more things, and I hope the policymaker can look into it and set the rules to control the vaping as well. So, do you know that e-cigarette deliver more concentrated nicotine than cigarette in a smokeless inhaled means? Health risks from vape products range from asthma to chronic obstructive pulmonary disease and even cancer. E-cigarette vapor also contain other damaging substance. Inhaling of this substance may cause severe or sometimes deadly lung damage. Then how about other type of smoke? People say cigar and smokeless tobacco products. Well, they are equally dangerous as smoking as well. Cigar smoking facing the same potential risk as cigarette smoking, including increased risk of cancer. Chewing tobacco or smokeless tobacco products are not safer than cigarette. And smokeless tobacco contain almost 30 types of cancer-causing chemicals.
Wow.
So, audience asking how to quit smoking.
I think that's the hottest question everyone wants to know. How to quit.
Whether quit smoking abruptly is dangerous or not. Well, there's no dangerous on quitting smoking. As I just mentioned, maybe already 20 minutes we have been talking about how dangerous smoking. It won't be more dangerous than continuous smoking. So, but we should do the process in a smart way and a planned way. Then the successful rate will be better. So, to increase the chance of quit smoking, one should be mentally prepared, and we should choose a relatively stress-free environment and time to do it. This will increase the successful rate. Physically, we must commit to exercising every day and getting plenty of rest during this period, because we are in a war. You see, we are countered with two main obstacles, namely a physical addiction to nicotine and also a habit.
Wow.
It's easy to build up a habit, but it's difficult to get rid of one. So always think why you want to quit. Simple reason is for your own health and is for your family's health. So we should a person who plans to quit smoking should start doing some exercise or activity each day to relieve stress and improve the health. And person who planning to quit smoking, they should form a group, seek for help, seek for encouragement from the family and friend. You even can form a group, a challenge group, to encourage each other. How long you have been quit smoking, what symptoms you experience during quit smoking, how do you tackle it, share the idea. This will increase the success rate. Rest is important during this period, and balanced diet is important as well. We should disconnect the activity of smoking and replace them with the newer, healthier activity, such as exercise, meditating, even prayers in a religious way will help as well. So it's important to understand that what we're going to face during this period. So there are a few physical symptoms such as of nicotine craving. This after we stop our last cigarette. So increased appetite is common when we stop smoking. So a lot of people will say, I always want to eat, I always feel like hungry. Because in the cigarette, there's content of two types of chemicals, which are serotonin and dopamine. All these two chemicals will make you feel better, will make you alert, and make you less appetite. So once you quit smoking, these two chemicals will deplete, and your appetite will gain back. And it comes later on is weight gain. So after quitting smoking, it takes about 2 weeks. You'll notice you're starting to put on weight. On average, you'll gain about 2 to 5 kg. Of course, this problem can be countered by a balanced diet, a good exercise, a good adequate amount of exercise. And the most challenging one probably will be nicotine craving. You will constantly have a craving when the nicotine level is depleted in our body. And it comes as fast as after 30 minutes, we stop our last cigarette. So this craving, it usually lasts about 15 to 20 minutes. And when it comes, we understand this is a crave and we should deviate our attention, try not to approach those triggering factors like the condition that allow you to smoke the next cigarette. What are they? Don't go contact with a person who was currently still smoking or carry a cigarette with you, carry a cigarette with them, or don't go start replacing smoking with drinking. Alcohol is proof that is another trigger for continuous smoking.
Yeah,
so
it comes together.
Yeah, so all this after understanding the withdrawal symptoms, you will probably prepare yourself and will prevent the next cigarette. Cough is common because our lung is trying to heal by itself, but is not there yet, so it cannot really clear the substance in our lung very well yet. So coughing is common. Headache and dizziness probably is one of the first symptoms of withdrawal, but usually mild and should be passed and should be able to treat with simple medicine. Fatigue is common, but it won't last long. Constipation is common in the first 1 month. Again, healthy, balanced diet plus exercise will help to solve this problem. A few mental and emotional behavior symptoms will occur during this period also. Anxiety, moody, or depression symptoms will come. But for a normal person, this should be brief. And for those who had anxiety disorder or depression before, the symptoms might hit you harder or will last longer. It's good to get advice from an expert to help you to go through this period. You might find yourself irritability, more agitated during this period, not only because of the withdrawal symptoms and also because you have to deal with other physical symptoms as well. You might find yourself a bit difficult to concentrate, but this should be brief and it will pass very fast.
Wow. Okay.
So apart from on your own, there's actually some other things that can help you to go through this period. you can choose to use nicotine replacement therapy. Means that some other substance will provide you a certain level of nicotine to help you go through these withdrawal symptoms. It shouldn't be the replacement of your smoking. So you must have a determination to quit smoking. Then with this therapy and gone through will help you to go through the withdrawal symptoms smoothly. And good thing about the nicotine replacement therapy is it only contains nicotine. It doesn't have other toxic substance like tar and the others cancer-inducing chemical. So this therapy, including nicotine chewing gums, nicotine patch, nicotine nose spray or inhaler, is available in our pharmacy counter. You probably can ask, or you can prescribe by a doctor.
So
Yeah.
since you are talking about nicotine, at the same time, I also want to address some of our crowd who just came to say hi. Hello, Adriana, Aaron, and also our fellow cardiologist as well, Dr. Lee Jenjung, who's very thankful for what you are sharing. Raisha, yes, betul. Suami kena tengok ini. Nur Hana, Nur Ainul. Yeah, I think a lot of our audience here are ladies, and they are listening on behalf of their husband, right? And so we really want to help them to help their husbands as well. So I think what you're saying, Dr. Ng, is that there's two parts, correct, to quitting smoking. One of it is the psychological, the mental, the spiritual, the support. And at the same time, there is also medication to help with it. And I think a lot of people think that when they want to quit smoking, it is all on their own, you know, that they must pull up all their reserves. But there are actually places you can go to get help to quit smoking, where a doctor can counsel you and also prescribe the necessary medication to you. They can go and see you, Dr. Ng, to have their heart checkup, do their stress test and everything, and also receive advice on how to quit smoking. For some, you can even go to certain KKM facilities, you know, klinik kesihatan yang dekat di rumah, you know. Or for some who wants help, you can drop us a DM in Facebook, and one of our care consultants will advise you on and connect you with a doctor to help you to quit smoking, so you are not alone in this. All right? Yeah, back on to you, Dr. Ng.
Yeah, it's very important. Dr. Jin bring up the issue. Yes, the first step is very important. So if you got the first step, you probably will move on smoothly. So if you do not know how to do it, ask a person, ask your friends, ask an expert. Then they will guide you, will lead you to a correct path. Then your journey of quitting smoking will be more smooth. So, we talked about so much on the quitting smoking. So, what are the benefits? What are the benefits of quitting smoking? So, the benefit of smoking cessation is start right away after you give up the last cigarette. So, immediately you will have reducing the pollution to the environment, and you will save money. That is most important. They will save a lot of your money. Okay, after 20 minutes to 1 hour, your heart rate will back to normal. Your blood pressure also will back to normal, and your circulation is improved. And this already starting to reduce the risk of getting a cardiovascular disease. After 12 hours, your carbon monoxide level will return to normal, so it's more oxygen in your body right now. You feel more fresh. After 1 day of stop smoking, the risk of heart attack begins to decrease. The blood pressure begins to normalize, and the risk of getting heart disease is reduced. Oxygen level in body also rises. It makes you more endurance to exercise. The benefit continue. After 2 days of quitting smoking, our lungs, our sense of taste and smell also will be better, because smoking damage our nerve ending responsible to sense of smell. Our diuretic endurance also will increase. After 3 days, quit smoking, the nicotine level in our body will be depleted. This is the time the withdrawal symptom kicks in. So after 3 days, this is the first challenge. Once might have mild headache, mild giddiness, and they will get moody and irritable. So all these are withdrawal symptoms. If you understand that, you overcome that, you adapt with the condition, you can continue to stop smoking. After 1 month, our lung function begins to improve, and the lung capacity also improve. Previously, former smoker probably will experience a lot of coughing and shortness of breath. This all will improve after 1 month, and again your athletic endurance will continue to improve. For longer term, after 9 months, the lungs, our smokers' lungs have significantly healed themselves. There's a reduced risk of lung infection because all the cells in our lung are probably restored and back to normal function. We can expel the waste even more effectively. After 1 year, a person's risk of coronary heart disease is decreased by half. After 5 years, the body heals itself enough. The artery and blood vessels are now begin to widen again. A widened blood vessel will less likely to be clogged, and the risk of stroke and heart disease will reduce. The risk of stroke will continue to decrease over the next 10 years. Wow. After 10 years, the chance of developing lung cancer are cut into half compared to someone who continues smoking. The likelihood of developing mouth, throat, and pancreatic cancer is significantly reduced. After 15 years of quit smoking, the risk of coronary heart disease is equivalent to those who never smoked before. The risk of developing cancer is reduced to the same level as those who never smoked before. After 20 years, the risk of death from smoking-related disease, including lung disease, lung cancer, pancreatic cancer, it will drop to a level who never smoked before. So whatever you do today is for long term. 10, 15, 20 years down the line, will be equal to those who never smoked before.
Wow. So what you're saying, Dr. Ng, is that given enough time, when we quit smoking, the adverse effect can actually, kesan negatif boleh diubah, correct? And there's something I also want to ask you, and I'm sure many are curious. There are some who believe that smoking, because it damages the vessels, and it sucks out your oxygen, is related to like erectile dysfunction, correct? In Malay, they say mati pucuk or tak boleh naik. So then, when you stop smoking, does it improve this problem?
Definitely, because one of the main cause of impotence, erectile dysfunction, is because of the blood circulation in the organ is jeopardized. Our sexual organ cannot engorge very well. That will cause erectile dysfunction. After stop smoking, the circulation will improve over the time, and this function will get back, a lot.
Wow.
So I think it's common that urologists will advise you to stop smoking before you start the treatment of erectile dysfunction.
Wow. So ladies and gentlemen, if there is one take-home message para penonton, jika anda mahu hubungan seks yang lebih giat, tolonglah berhenti merokok.
True. It's a long journey. It's not to say just the side effect of cigarette chemical kicks in faster than the benefit of the stop. So over 10 or 15 years, if you still smoke on and off, then you want it to have a good result. It probably is impossible. So we must have constantly quit smoking over the 10 to 15 years. Then you will bring down the risk for getting a cancer or coronary heart disease. Okay, so we have to follow the trend. Now is the COVID-19 pandemic. How does this COVID-19 pandemic affect smoking, or how smoking affect COVID-19 pandemic? Okay, up to this time of review, the available evidence suggests that smoking is associated with the increased severity of disease and death in hospitalized COVID-19 patients, which means that persons who are being admitted to hospital because of COVID-19 and they are smoker, the risk of the disease become more severe or even death are higher compared to those who are non-smokers. But does it mean that if you smoke, it's easier to get COVID-19, or those who have COVID-19 and smoking must be those who got COVID-19, they are easier to get because of smoking? This is yet to know. But there are a few important facts. Adults who had lung or heart-related condition might be increased risk of hospitalization, and even that if they contracted the COVID-19 virus. So what causes a heart and lung condition? Smoking. Okay. Those smoking-related conditions like heart disease, airway obstruction, and cancer will seriously complicate the management of COVID-19. You make the treatment even more challenging. On top of we are still a puzzle of how to treat COVID-19. If the smoking continues, one will have greater risk of respiratory infection like common cold or flu or pneumonia. This will complicate the picture and eventually make it become more susceptible to COVID-19 infection. And it's well known that smoking, it will weaken the immune system. It makes the smokers more easily to catch any infection, including COVID-19. Okay, I have to bring up this point. Try to observe our surrounding. If you happen to see people smoke or smoker who being chased out from the eatery, you'll see it tends to gather around. And we know that COVID-19 spread through touching, coughing, and it just suits those smoking behavior, because smoking behavior is a hand-to-mouth behavior. So whenever you touch, you hold your cigarette and you put it into a mouth. That's how how people will contract it with this virus. And if you smoke, you're probably not wearing your mask. And the smoker tend to gather in one place and probably not very well distanced, and this will increase the risk of infection. As we smoke, we inhale deeply, and the aerosol, the smoke, the aerosol from the vaping, it actually forms a lot of droplet. You actually bring the droplet the virus. This is how people get COVID-19 infection. So this is basically how smoking happened in the phenomenon of smoking during this pandemic. But interestingly, this pandemic or lockdown, it provide good timing, a right moment for a person who never think about quitting a smoking habit to quit right now. However, one must understand that this pandemic, this lockdown actually is a more stressful period. So it made the challenge, the quitting smoking much harder to succeed. People will choose not to quit at this timing. It shouldn't be stigmatized. But if those who are willing to stop smoking right now, the others around them, the family, should help them as much as possible to quit smoking.
Definitely.
Yeah. So bear in mind there is other agents like nicotine replacement therapy or medicine is available, and it works much efficiently with combination of counseling. Interesting fact: some study in England actually show that the rate of quitting smoking attempt during this pandemic is increased, and the successfully to quit smoking was more than double during this period. So I hope this also happened in Malaysia, although we do not have a trial like that. I hope this whatever happened in England also actually happened in Malaysia. And at the end of the day, after the COVID-19 pandemic, we can see the numbers of smokers drop. Okay, this is probably the end of my slide. Before we end this topic, there's a Q&A for the audience. Okay, there's no reward for the there's no prize Q&A, but and there's no definite question for the Q&A. I hope if you do not carry any information, any knowledge after my presentation, please remember these two questions and always ask yourself: which are the following can be stopped? A, your strong and regular heartbeat. B, the fresh air being delivered to your lung. C, the blood circulation that helps your brain working. D, the blood vessel that delivers oxygenated blood to your leg. And E, a smoking habit. The second question: which are the following is the least important to you? A, your health. B, your partner's health. C, your child's health. D, the money in your pocket. E, your cigarette in your hand. With that, we end the topic today. Thank you for your attention.
Wow. Thank you so much, Dr. Ng. I think the last question is a really good one, especially in this season where we don't go out. It's really important for us to reflect. We make choices every day. We go through difficult things every day. Our job is hard, life is hard, and sometimes we turn to cigarettes in our hand to make things easier. But you showed us that, but there are so many other things like our health, our partner, our wife or our husbands, our child and our finances. And by quitting smoking, we can really improve everything else. Correct, Dr. Ng? Yeah,
exactly.
So we have really overextended by about 10 minutes because of the overwhelming amount of response and audience and the questions they have asked. So if you don't mind moving on to your last slide, Dr. Ng, there's a bit of a QR code there. That's our way of helping the audience get in touch with you. I believe they can arrange to make a booking with you, whether to get a cardiological examination done up. I think a lot of us are overdue for one already due to the stress of COVID and things like that. So if Setapa is near where you are, you can certainly scan the QR code or even drop us a message if you have difficulty with technology, and we can help to assist you to get an appointment done with Dr. Ng. So with that, thank you very much. We will catch up again. Happy Chinese New Year, everyone. Take care and stay safe. Bye-bye.